Today we have Dr. Fugen Neziroglu, Director of the Biobehavioral Institute in Great Neck, New York, and a specialist in obsessive compulsive spectrum disorders. Dr. Neziroglu, can you tell us a little bit about how you became interested in obsessive compulsive disorder?
Sure. I really don't want to say when, because it was so many years ago when nobody was talking about obsessive compulsive disorder, or OCD as it's known. At the time, our psychiatric books really indicated that only 0.5% of the population had OCD, and we felt that there were many, many more people, but that they were just secretive about it. So we started actually asking people questions about obsessions and compulsions when they came in for anxiety and depression. Oftentimes these individuals were diagnosed as being schizophrenic because the symptoms seemed so bizarre to the average clinician. So I would say in the 1970s we formed a little group. In fact, the Obsessive Compulsive Foundation was formed. We used to meet in libraries and try to disseminate information, educate the public, and before you know it, more and more people became interested. We got the media involved. We brought enafrenil into the United States, the first anti-obsessive compulsive medication. And I started the first intensive programs, cognitive behavioral therapy program, in New York. There was only, at the time, worldwide, 2 other programs that existed for OCD. So it's going back a very, very long time.
And what exactly is OCD?
Obsessive compulsive disorder consists of 2 main symptoms, let's say, obsessions and compulsions. Obsessions are thoughts that we have, such as aggressive obsessions, seeing a sharp object and thinking you're going to hurt yourself or others, religious obsessions, blasphemous thoughts against God, thinking you're possessed by the devil, or sexual obsessions, thinking that you're gay, staring into people's genitals or breasts, having sex with children or animals, anything that's taboo actually. There are counting obsessions. There are obsessions about having things in a particular order and arranging things in a particular place. Compulsions are actions that you perform to undo the obsessions. For example, you wash your hands or take long showers in order to get rid of the dirt or germ or illness that you think you've contracted. It could be double checking, checking light switches, doors, lights, appliances. It could be putting things in a particular place and feeling very anxious if somebody moves it out of place. It could be making a phone call when you have a good thought and not making the phone call when you have a bad thought. Superstitions, repetitive behaviors, having difficulty walking in and out of a room. So these are kind of some of the common obsessions and compulsions, but it could be a variety of forms of obsessions and compulsions.
What are the common, symptoms that we should be aware of, or signs that parents should recognize when observing their children?
Children often do not talk about their obsessions and compulsions, and I really feel very sorry for them because they suffer for many years at times because they're so afraid. They think there's something dreadfully wrong with them. So even to their own parents, they're embarrassed to say what's going on in their minds. But at some point or another it becomes so intolerable. Either the actions are observable or the thoughts are just intolerable, and therefore they tell a parent or a teacher. One of the things that is very common in children is really repetitive behaviors, good night rituals, saying good night several times, asking for reassurance. Do you love me? Do you love me? I love you, Mommy. I love you, Mommy. Repeating these kind of things over and over again. But they could have similar obsessions to compulsions, rather, because children don't tend to have obsessions. They tend to have more compulsions than obsessions. They're very concerned about something bad happening to a parent. So they may do various different acts so that the parent is safe. So to a parent or to a teacher, it may appear as if the child has separation anxiety, doesn't want to go to school, and that's probably because they're afraid something will happen to Mommy and Daddy if they go.
And are there very differing symptoms in adults?
Symptoms may be similar, as I said, between children and adults. they share some symptoms, but adults tend to have many more thoughts. You could have pure obsessions, just thoughts that go on in your head without performing any kind of ritual. Children tend to perform rituals rather than having thoughts.
You mentioned earlier cognitive behavior therapy. Is that the treatment for OCD?
Cognitive behavioral therapy actually specifically exposure and response prevention, exposing someone to their fear and preventing them from engaging in the compulsion is the only form of treatment that is found to be effective for OCD. Other forms of treatment have no research basis for it, and people could suffer for years and years trying to find the root to their problem, and finding a root to their problem, whether it's toilet training, whether it's the way their parents raised them, or some trauma, is not going to solve their OCD problems.
And in addition to the cognitive behavior therapy, are medications necessary?
You don't always have to use medications to treat obsessive compulsive disorder. However, we do have specific medications called SSRIs, which are selective serotonin reuptake inhibitors, such as Prozac, Paxil, Celexa, Lexapro, fluvoxamine. All of those are found to be effective for the treatment of OCD.
Thank you so much for being with us today, Dr. Neziroglu.